What is acute lymphoblastic leukemia? Leukemia is cancer of the white blood cells. Acute leukemia means the condition progresses rapidly and aggressively and requires immediate treatment. Acute leukemia is classified according to the type of white blood cells affected by cancer. There are two main types. Lymphocytes, which are mostly used to fight viral infections. Neutrophils, which perform several functions, such as fighting bacterial infections, defending the body against parasites and preventing the spread of tissue damage. Warning signs of acute leukemia. Symptoms of acute lymphoblastic leukemia usually begin slowly before rapidly getting severe as the number of immature white blood cells in your blood increases. See below for an explanation of this. Symptoms include pale skin, tiredness, breathlessness, having repeated infections over a short space of time, unusual and frequent bleeding. What happens in acute leukemia? All of the blood cells in the body are produced by bone marrow, a spongy material found inside bones. Bone marrow produces specialized cells called stem cells which have the ability to develop into three important types of blood cells. Red blood cells, which carry oxygen around the body. White blood cells, which help fight infection. Platelets, which help stop bleeding. The bone marrow usually produces stem cells which are allowed to fully develop before being released into the blood. But in acute leukemia, bone marrow starts releasing large numbers of immature white blood cells known as blast cells. As the number of blast cells increases, there is a drop in the number of red blood cells and platelet cells. This drop causes the symptoms of anemia, such as tiredness, and increases the risk of excessive bleeding. Also, blast cells are less effective than mature white blood cells at fighting bacteria and viruses, making you more vulnerable to infection. Around 8,600 people are diagnosed with leukemia each year in the UK. In 2011, 654 people were diagnosed with acute lymphoblastic leukemia. Despite being uncommon overall, acute lymphoblastic leukemia is the most common type of cancer to affect children. Approximately 1 in every 2,000 children will develop it. About 85% of cases occur in children aged under 15, mostly between the ages of 2 and 5 years old. The cause or causes of acute leukemia are uncertain, but known risk factors include exposure to high levels of radiation, exposure to benzene, a chemical used in manufacturing that is also found in cigarettes.